much. I'd like to just share a disclaimer, which is really my association with this was really minimal. MashaAllah, the massive bulk of work was done by Dr. Nazim Ghouri and certainly Dr. Salman Vakar, who was, of course, mashallah, the lead person for all this. I was just really honored to be part of it in some way. Essentially just linking people together. That was my main role. I think we'll move on to our panel discussion. Before we do so, I'd like to introduce our panel member, Dr. Billal Patel. Dr. Billal Patel is a consultant interventional radiologist working in Lancashire Cardiac Centre in Blackpool, Victoria Hospital for the last 5 years. He was born and bred in Preston, Lancashire. He studied medicine at the University of Liverpool. He's done PhD from the University of Liverpool, and his cardiology training is also from Liverpool. He has got interest in lifestyle and dietary modifications for optimal health and prevention of cardiovascular disease. Most of you would probably know him from the now viral videos, which are all over the internet, especially in the Muslim WhatsApp chat groups. And mashallah, he did some really good work sending those real messages out, more important, reliable messages out, especially when the whole COVID crisis started. Later on, I saw a couple of other videos as well. So, Assalamu alaikum wa rahmatullah, Dr. Billal.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakallah khair for joining us today. So before we go on to the panel discussion, if I can just ask you, and mashallah, I know your interest is about education, educating community, and especially the Muslim community. So in your opinion, how has the COVID impacted patient health-seeking behaviors? I mean, especially with Ramadan coming up. I mean, what are the challenges you are experiencing, especially addressing the Muslim community and also by extension the BIMA community?
Yeah, so we've found a big reduction in patients wanting to go to hospital for even serious conditions. So we looked in our own centre and we found that for ST elevation myocardial infarction, there's a reduction by around 33%. And of the ones that were coming to hospital, they were waiting twice as long before seeking medical help. So generally, these patients are a lot sicker with a lot more complications from the myocardial infarction. When we looked into it, we found mainly sort of 4 main reasons why. One is fear of contracting COVID. The other one, which is really more relevant to our community and the BME community, is the fear of being admitted into hospital, because once you're admitted, you get no visitors. And then the next that you might hear is you'll either be discharged, or if you're very ill, it'll be a phone call coming saying that your relative has passed away. And this has also prevented a lot of people from seeking help when they should be contacting hospital when they're really ill. And then there's this sort of notion that people don't want to be a burden on the health system. And the final reason is when people have symptoms, they attribute it to COVID when actually it's a heart attack or something serious. So that's what we found. And then we thought, well, how do we raise awareness of this to say, well, for heart attacks are life-threatening conditions, we're treating these as you would do normally, and try and reassure people and patients that we do our best to protect you when you come into hospital. Heart attacks are very dangerous, although there might be a fear of COVID. You do need to seek help, and we're doing everything possible to ensure that safeguards are in place. So then we put a little video out, just to reassure people. But then we thought that in the BME community, this community incidence of cardiovascular disease is far greater than the general population. And also that the mortality and morbidity from COVID is also disproportionately high. So this population actually suffers the most from both aspects. We're quite fortunate to work with an international global team in Blackpool. And we then made videos in multiple languages, in Urdu, Punjabi, Bengali, and we had multiple European languages as well. And we put these videos out, and then it was really to try and get these messages out to where it was needed. So we used social media platforms on Twitter, on YouTube, the hospital website got onto this, and then the local press and the local TV station got onto it. But really, I was keen to try and get the message out more, targeted towards our community. So we contacted some Urdu-speaking, Bengali-speaking websites and news organisations. We tried to get it out in the communities, and we found out last week that NHS England now are keen to use the multilingual videos from a top-down approach as well. So, inshallah, the aim of this is really to try and get the message out. So, COVID has been a sort of trigger for this, but normally our community is and population, generally they present late with cardiovascular symptoms. So I think it's a really important message, even in normal times as well, to get out.
It truly is a very important message, and as you rightly mentioned, although this crisis started all of this, but alhamdulillah, there was blessing in the apparent misery that it has brought us with it. With respect to you being a cardiologist, and I'm sure, mashallah, being apparently practicing or visible Muslim clinician, you would get asked these kind of questions all the time. So one of the difficult bits that people feel is like when you've got a chronic condition, a chronic but a stable heart condition, when people come to you, what kind of advice would you give them normally, whether you're able to fast or not to fast? What kind of principles are there? What kind of help and support is there for you to guide whether this person should be able to fast or not fast?
Sure. So, so we follow sort of principles that were outlined before, in terms of, is the condition that they've got, is it going to be harmful to the patient? Is there a risk of their condition getting worse or the condition delaying recovery, and a significant fear of both of the above? So for the chronic conditions in cardiac disease, and the ones that we come across most often is patients with heart failure or patients that have had a recent myocardial infarction, and a lot of the issues with fasting is to do with the medications. So for the heart failure patients, it's to do with the diuretics. So when you're fasting, you've got an increased risk of getting dehydration, developing kidney disease. If you're very symptomatic with heart failure, then generally I advise them not to fast. For the patients and the ones we see more of are the heart attack patients, and if they've had a heart attack in the last few weeks, we generally advise to avoid it. But more importantly is the compliance with the medications. So most of the patients who've had a recent heart attack will be on antiplatelet drugs, and the ones that we most people use are dosed twice daily, and non-compliance with these medications can be serious. So what we have found is sometimes people will just take it once a day, which puts them at increased risk of the stents blocking off. And the other thing that I've found recently is because the fasts are quite long, they're actually taking 2 blood thinners, in a sort of window of between 3 and 4 hours. And then this can increase the risk of bleeding, and you don't have the efficacy over the 24 hours. So for that particular group of patients, we advise either to not fast, or if they can get the antiplatelet drug changed through their cardiologist. I think for all of these, the important thing is I normally say, we have a discussion with the GP as well as the specialist, and for them not to sort of make any changes on their own.
Certainly, that is the message that we're trying to convey as well. But what I found was, the BIMA guideline, which has been made, mashallah, has made the job a lot easier. I don't know whether you had a chance to look at that, the cardiology section.
Yes, no, I had a look at the cardiology section, and it's very, very well written, very comprehensive guidance, and it's really the first time I think we've ever had anything of this sort as a guide, and it's a fantastic piece of work, I think, which will be very, very useful.
Inshallah. Coming over to Dr. Sheikh Rafaqat, as expected, multiple questions there. Some of those are more in principle. It looks like, of course, some of our audience are new. Some of us are students of Fiqh of Medicine course, which is, mashallah, really famous. It's a very basic question, but I think it is important that we address it head on. This is a question: is there any specific hadith that mentions that certain routes would invalidate the fast? One specific hadith that would cover, and specifically the question is about the bloodstream, introduction of food or medication through bloodstream that can provide nutrition to the body. So the question is very particular about a hadith, a quotation of hadith here, not fiqh. You're muted, Dr. Sheikh Rafaqat.
Okay, Bismillah ar-Rahman ar-Rahim. Yeah, generally speaking, the way the fuqaha work, the way the Muslim jurists work, is they would first of all extract from the Quran. So they will make reference to the nas itself from the Quran and look for those verses of the Quran which are sarih in terms of they are very clear in the meaning. And the Quran just really, in essence, provides a very basic sort of concepts which need developing from the prophetic tradition and in terms of how they are applied. So here we have the issue relating to refraining. So the fuqaha take from the Quran the imsak, refraining from eating and drinking. Now the question from that arises, there are a number of prophetic traditions that you'll find that sometimes can be quite specific, sometimes non-specific. So for example, there is the instance of the Sahaba who basically inhaled water up his nose, and the Prophet ﷺ prevented him from doing this with force, with extreme, because that would in essence invalidate his fast. So this formulates, I'm just giving you one example, so this formulates a track of rulings that the fuqaha work with on the basis, why did the Prophet ﷺ prevent this particular Sahabi from doing this companion from doing this, and they conclude from that is because clearly that would suggest that the water would be going further down, passing the throat and entering the tract. So there's a number of other hadith. There's the hadith of interesting of Umar radiallahu anhu, which he approached the Prophet ﷺ, and this is when he went into that elaborate detail. And this is the beauty of the prophetic tradition, because it's very practical in the sense that the companions approached the Prophet ﷺ on very personal issues. So even he approached the Prophet ﷺ saying that he had sort of a relationship with his wife in the sense that they were kissing. So clearly his saliva must have mixed in with her saliva. So would that invalidate my fast? So the Prophet ﷺ responded to that on the basis that, you know, if you were to gargle when doing wudu, would that invalidate your fast? So he demonstrated a process of how we enact or do istidlal or ijtihad, you know, in terms of how we come to conclusions from the fiqh perspective. In other words, he did qiyas. So he said that, look, when you gargle water during ablution, that doesn't break your fast. So from there you can provide that analogy here, and it'll sort of come to the same conclusion. So you'll find that in essence it's done from a number of different ways. There are clear hadith, and there are those hadith that are not as clear, and these are taken together. Certain principles are sort of derived from them, and those principles are then applied to the understanding from the sort of medical perspective how the system works.
I hope that satisfies the questionnaire. Now, there's a question, and there's a recurring theme that I've seen. Actually, I think this has been come up 3 times now. The questionnaire basically says that what is the reference in Sunnah and Fiqh that gives allowance for a worker to break his fast due to demands of the job and work? So you mentioned initially that, of course, you would start off the fast and you will try your level best to continue, and then you would only break it if certain conditions are met, and you are struggling, and you elaborated on that. Can a worker just not fast based on that experience of one day, not start to fast the following days or for the rest of the Ramadan? I think that's what the question is wanting to ask, really.
Yeah, there's a couple of issues there again. I mean, there are what we call maxims that the sort of jurists provide in how we deal with the whole issue. So there are verses of the Quran. So you know, yuridullahu bikum al-usra wa la yuridu bikum al-yusra. So basically, the verse of the Quran which relates to the fact that we, you know, that Allah brings ease upon you. So you know, you don't go wala tulqu bi aydikum ila tahluka, don't bring yourself to your own self-destruction. So there are certain concepts that are used there, and from this there are certain maxims that are provided, the kuliyat. So for example, al-mushaqqatu tajlibu al-taysir. So hardship, you know, in essence lays to the idea that, you know, ease should be introduced into such rulings. So on that basis, the those are the maxims, those are the sort of principles that we work from. And then there's a question of application, and application then is defined by the fuqaha. And so the concepts of application are related to a number of points. One is the issue of, number one, recognizing there are experts who can inform us about what is likely to happen, what is a negative outcome as on the basis of if you do fast. So this is where it makes reference to the idea that we should go to somebody who's a tabib al-hadiq, a doctor who has experience. And the second idea there is having a predominant understanding about the possibility of that particular outcome happening. So we use a concept which has been mentioned a number of times, which is ghalabat al-dhann. So ghalabat al-dhann is where there's a predominant probability that something's going to happen. So that can be based on a number of different things. It can be based on the experience of a clinician who clearly has that experience. And you can have your own personal experience, because sometimes you don't need to approach doctors. You know yourself better than others. So if you know that there is I'll give you an example. I had somebody who presented, sort of contacted me a couple of weeks ago related to gout. This is even before Ramadan. And he recognized that during Ramadan, what tends to happen, he's got this real tendency that he gets gout. And when he gets gout, it's very severe gout. So when he gets severe gout, he's in immense pain. He can't function. He needs to take regular pain relief throughout the day. So, he's virtually bedbound with the level of gout. So he gets it in his knees, he gets it in his wrists. So he gets it quite severely. So on that basis, the question that I would approach him is, what's the chance of that happening if you were to fast? And he said, well, there's a very good chance it's going to happen because it happens every time. So that would be his own tajriba, his own particular understanding. If he was to approach a clinician would have to inquire of those details and to give him that, to address him from that perspective. If he was to approach a scholar would probably turn around and say, go to a clinician and ask them whether it's worthwhile you fasting. So this is real grey area, which alhamdulillah, we've identified, and there's been quite a bit of work done, alhamdulillah, with the work that that's been mentioned by Dr. Nazim. So this is very, very important. I think your audio's off.
So next one is for Dr. Nazim Ghouri. So mashallah, is amazing work, 100+ pages document. There must be a few bits missing in there. What are those bits, and there's something that you need help with at the moment?
So as I mentioned, a lot of this is opinion of, or a consensual opinion of a number of doctors in the field who hopefully are experienced and expert enough to understand the medical aspect as well as the Ramadan aspect. But unless you have evidence from the management of patients, whether it's your own caseload or ideally publication in a peer-reviewed journal, because then you'll have higher numbers, or at least you'll have a standard where you can at least hang your hat on it, then that helps give more confidence. It comes back to what Dr. Sheikh Rafaqat is talking about, this concept of ghalabat al-dhann, the chances of it happening. All these theoretical aspects become evidential in terms of the studies that undertake. And I'll give you an example. So the adrenal paper, which we've got that's under review at the moment, that we're just doing some corrections. The reason we can give advice on prednisolone and dosing and everything, because there's actually a study that's been done to show that it works. So whilst we as an endocrinologist, I've done this theoretically last year, there's a study that's been there, and there's some other data which we are bringing into the guidance. We're writing guidance for the Society for Endocrinology and for endocrinologists. But we've got a study or two there that we can actually refer to support our statements, both from a safety perspective, but also to give some reassurance as well. And where there isn't that evidence, we highlight that. So the idea that this guidance, I'm hoping, is going to enthuse and give and encourage people who are perhaps a bit shy or a bit hesitant to undertake research in Ramadan in their various fields or specialties to do so, because then that makes our job easier in terms of preparing this guidance, but also when it comes to giving advice to your individual patients, or when it comes to clinicians talking amongst themselves, or the scholars want some further reassurances, will this actually happen? That comes from evidence. So that's what we really want people to do, is undertake studies, or at least from their own caseload, try and come up with some case studies or case histories to add to that. And as we know from NICE and SIGN guidelines, the evidence is based on the numbers and the number of studies and so on. So we need to start and work our way up from the expert opinion. I'm not disputing expert opinion, because often expert opinion is largely confirmed, but it can be refined by having these studies. So that's what I'm really hoping for. And obviously, we haven't covered every single condition, every single specialty. The hope is that, inshallah, with more people showing an interest in coming on board, we can add to that existing kind of group of conditions we have. And I guess the other thing is getting the external recognition from the authoritative clinical bodies which we are all work with and governed by. Because then that what happens is from a medical legal perspective as well, if people are following it, it gives more strength and credibility. That's why the more stuff that's published in peer-reviewed literature, it helps give confidence to these external bodies to use what is there.
Indeed, it is. Jazakallah khairan. More of a personal question to Dr. Billal Patel. We know, mashallah, you're interventional cardiologist. I'm a GP, so alhamdulillah, you know, in terms of PPE and wearing gowns, I'm very limited in terms of exposure. So your work naturally involves a lot of patient contact and, of course, working closely with other colleagues as well. How are you finding Ramadan this year with PPE? And you don't have to share it, but have you had used exemption?
No, so I think before Ramadan started, I was worried that it was going to be really difficult wearing the PPE all day because we've got this big respirator mask. It's quite tight. And prior to Ramadan, when you've got it on, even for a few hours, you know, sometimes the case can be 3 hours long, you feel dehydrated. But alhamdulillah, once Ramadan, and I thought at the time that we'll see how it goes, but if it comes to the stage where you think you're going to put patients at risk, then you might have to break the fast. But since Ramadan started, you know, we've done some very long days, done some long on calls with several cases, and alhamdulillah, it's been absolutely fine. And with the team I work with, you know, I've got several registrars that are Muslim that are fasting, doing the same as what I'm doing in the cath lab, doing these cases, and each and every one of them, alhamdulillah, has been absolutely fine. So I think the anxieties we had was really more, they haven't actually affected the fast. You know, so the longest I've had the equipment on, I mean, we did a list last week from 9 till 5 o'clock. The equipment was on, you know, pretty much all the way, just with a short break in between cases. And it's been fine, alhamdulillah.
Alhamdulillah, mashallah, that's amazing, mashallah. Mashallah. Tells you about your fitness as well, probably, but mashallah, that's really good to know, mashallah. Going back to Dr. Sheikh Rafaqat, of course, we talked about the importance of starting the fast and then only breaking it if it was really, really necessary. This is a question, I think, again, we heard last year as well. Not that this year the exams are taking place, but more of a hypothetical question where a university student, sixth former or GCSE student is expected to fast in these long summer days. And we know that, you know, it's going to be long, but they can't risk having that period of low concentration. So it's a preemption where they haven't tried it before.
Okay. I think I have addressed this in previous sessions, but generally speaking, when we look at the idea of the default position in Islam has always been that one must fast until they're in a situation where there is hardship and then they can break their fast. So they have this permissibility to break their fast. And the way that's compensated is you just do qada, you don't have to do kafara, okay? So that's an important thing to understand there. Regardless of the fact that you're eating and drinking, it doesn't make a difference. The fact that you've been excused on the basis of hardship, then you would just do qada and not do kafara. Now, in relation to the idea, I think sometimes we get this really confused. We confuse the idea of a hardship of fasting on two grounds. One is feeling tired, not because one is fasting because of lack of sleep, and feeling tired because clearly somebody hasn't had enough to eat, and for that reason they're feeling weak. We need to differentiate between the two. Now, I find that a lot of people usually, I mean, in my good old days, we used to do all-nighters and stay the night up and, you know, work hard and have very little sleep and then go into the examination room the next day. So, you know, you need to question yourself whether this is related to the fact that it's lack of sleep, and that's the reason why you're feeling tired, or what is truly related to your fasting. There's a lot of evidence to suggest, and there are some papers out there, journal papers, that basically do indicate that there is no direct link between fasting for a certain period of time, like we do in Ramadan, and our cognition, in our ability to concentrate and focus, but rather that is mainly related to other issues, like, for example, lack of sleep and various other things. We don't fast long enough for us to be compromised. So if you're in an environment like Dr. Billal mentioned, that clearly you're very hot, you're in a sort of an extreme environment, you know, of temperature or kind of a harsh environment, then clearly those will play into this, and then that would have to be discussed and dealt with on that basis. But generally speaking, overall, if the environment's fine, then there should be no reason why you shouldn't have to break your fast, unless clearly you're feeling dehydrated, you're feeling very weak, and so forth. So I think this question of the fact that, you know, my child will not perform, or I will not perform on the basis that I'm fasting, it doesn't hold even from a scientific perspective. Rather, you need to question that, are you getting enough sleep? Are you having a good diet? Generally speaking, in the sort of non-fasting hours, to make sure. And recognizing that in Ramadan, maybe not as much this Ramadan, but generally speaking, Ramadan, you know, we stay up till quite late. Some of us don't even sleep, but we just stay up throughout the whole night, worshipping Allah subhanahu wa ta'ala. So on that basis, you'll find that, you know, sleep is a big player in this. So we need to ensure that we get plenty of sleep. That's sufficient enough for us to, you know, not to feel weak in the next day. So let's not confuse the two together. Fasting in itself, you know, unless there are additional factors to it, you know, it should not be of serious hardship for individuals who are fit and healthy.
Jazakallahu khairan. Next one is, so before I go to the next question, I mean, in case anyone wants to ask a direct question, they can raise their hands and I can unmute you. So feel free to do so, inshallah. So there will be a raise icon there, and if you want to, then please do so, inshallah, and I will unmute you. Sorry, Dr. Nazim, you want to say something?
Yeah, just building on what the Sheikh is saying, there is also guidance from WHO as well, World Health Organization, saying, and we've referenced this as well, saying that, for example, in light of COVID, there's no known increased risk. So again, there should be no reason not to fast. And even there was some information on Public Health England website. So I think part of it comes back to this concept that all things being equal, you go with the status quo, which is that you fast unless there's a reason not to, and only and if a circumstance arises which there's where there's some kind of compromise, you'd obviously break the fast in that. But also you might have to do your homework and work out why was it, as the Sheikh mentioned, is it the sleep aspect of it? Is it that you didn't eat enough? What was the actual mitigating circumstance? Or was it simply the fact that you're now 15 days into the month of Ramadan, it's quite warm, you've just not been drinking enough on a daily basis, and what's happened is you've started to kind of decompensate physiologically after a period of time. As an endocrinologist, we often get asked stuff about how much water should we drink, and we do things with diabetes insipidus and even diabetes. So the important thing is to understand that there is a cumulative effect of fasting on the body in terms of physiological adaptation in a positive way, but also if you're not giving your body its due over the month, then you will also cause harm, particularly if you have other illnesses, if you're older or you're less fit. And I think this is something you have to realize, is that Ramadan, if you like, relatively speaking, is a marathon and not a sprint, and therefore you have to prepare yourself as such and address things on a regular basis and at intervals, and not let yourself get into a somewhat blameworthy circumstance by neglecting yourself in the first few days, so that in the middle of the Ramadan you have that dip because you've not been doing things properly until then.
Right, okay, I'm just going to open up the mic now. So first one is for the Saifuddin. So I would request you to kindly just tell who the question is to, first of all, if that's okay. And you can speak now. You have to just unmute yourself with the Saifuddin.
Yes.
Yeah, we can hear you now. You can ask the question.
Assalamualaikum warahmatullahi wabarakatuh.
Wa alaikum salam.
Thank you very much for this opportunity. I would like to ask about the effect of the fasting regarding the autophagy mechanism in the body. So we know that the Nobel Prize winner from Japan researched about the autophagy in yeast, and then compared to the human body regarding the fasting. And my question is, there is an effect of the fasting to increase the autophagy and to remove the cell and then change with a new one. And my question is, how can we keep the something like a fasting treatment to our patient to increase the body function because of the increase of autophagy, removing the old cell or bed cell, and then with a new one cell, something like that. Thank you.
Jazakallah khair for your question. I think it's probably relevant to Dr. Nazim Ghouri. So what Brother Saifuddin, just in case we couldn't hear him well, is referring to is some study done in Japan where it mentions that there is a process of autophagy that is seen in certain animal specimens when they are exposed to fasting for a certain number of hours. So is there perhaps any evidence to support that? And if there is, then what would be your recommendation taking it further?
I mean, the thing is, I would have to hand up and say I don't know enough about autophagy in general, let alone autophagy in relation to fasting. I think I'm not sure what the specifics if he's able to enlighten me in terms of what the specifics are involved, in terms of what it entails or how it's done, then it makes things easier for me to understand. But I can't answer the question because I don't know enough.
Okay. So again, we're not talking about specifics here today, and I think I'll skip that question. Moving on to Asmar Akram. You're unmuted now. You want to ask your question?
Hey, Jazakumullah. Can you hear me okay? Yeah?
Yes, we can. Assalamu
alaikum. I just wanted to run past something past Dr. Rafaqat Sahab will be aware of this, the issue of children fasting, exams, etc. You know, the discussion amongst awqatus salah and timetables. Okay, I just want to get people's thoughts on this. Obviously, in an ideal situation, the family would follow the same timetable. But if we use these certain concessions and the various differing opinions and you can actually enhance the eating time for some people by sometimes a number of hours, certainly the further north that you go. So for children that are fasting, is that a tool that we can use? Is that a tool that we should use? Now, before somebody comes back and says, oh, how can you have the mum and the dad fasting early? If you think about it, the adults usually cope with the long fasts better. So if you have a mother, for example, that's doing, just say for argument's sake, she's acting on the earlier opinion, and it's not just about degrees, which is a misconception, but then she can wake the kids up 2 hours later or 1 hour later and then cook for them. It makes it easier for her. The children, sometimes, you know, if you wake them up too soon after they go to sleep, anybody that's got kids, it's an absolute nightmare to wake them up. So hopefully you guys have understood my question about giving where there is possibility of using different timetables, because I think the community has developed, everybody is aware that there's an ikhtilaf in timetables. Some masajid have actually printed different options. Nazim might be aware of this up north, you know, so I just wanted to see what your thoughts were about actually giving people essentially longer nights where it is possible.
Okay, generally speaking, in response to that, you'll find that Muftis usually, when they are to formulate general fatwa, what they will do is they take into recognition how that fatwa will be applied by the general public. So on that basis, when you give a general fatwa, so these are sort of the fatwas you'll find on websites, you'll find them in books and sort of in articles. And they are quite explicit, they're out there, and they address a specific question usually. So usually what you have is you have a mustafti, somebody who questions, puts a query to a mufti, and he addresses and responds to that. Their response usually tends to be a response to a general population, even though they're addressing a specific question. They bear in mind the fact that people will be there, this is a public sort of website, and anybody can sort of approach this website and they'll see that response and then they can act upon that. So for that reason, they will always give a general response or something that can be applied throughout the general population. Then there is something about shakhsi fatwas, where you somebody approaches you on a personal issue, and their individual circumstances may be quite different from others. So here you can, you may employ more specific rulings which are not necessarily the common ruling or muftabihi qawl, or the most common ruling on that particular madhab, or it may even be from a different madhab, from a different school of thought, just solely on the basis to address the question. So that may be a question that allows us to endorse the ruling of need and necessity, or darura, for us to employ that. Now, in relation to your question, when you're looking at the different awqat, the different timings of iftar and so forth, and the different the number of hours per day, on a general format, you will find that ulama, muftis, are probably very reluctant to pass this out as a general fatwa in public, but rather if somebody was to approach them individually because of some serious difficulty that they're having on that level, then they would probably address that from this particular perspective, and they may resort to some of the less common opinions within that school of thought. Having said that, if there was the concept of dhurura manzatul haja, so basically dhurura and necessity can come to a level of just need if it is there's a public predicament. So if you're finding that the whole of the population is in essence, or majority of the population is struggling with a serious issue, then these kind of things can be endorsed more generally as well. At the moment, we haven't reached that sort of level of hardship, even on a public level. So for that reason, endorsing awqat issues related to the times of fasting have not been endorsed by any of, as far as I know, the majority of the ulama in the UK or many of these places around the world. But clearly, if it was a public predicament and there was a large population that was being impacted by this, then that is something to take into consideration.
I'm going to open the mic for Amira Hamid. If you unmute yourself, you should be able to speak.
Ji, assalamu alaikum. Can you hear me?
Wa alaikum assalam. Yes, we can.
Yes, my question is for Dr. Rafaqat. If I heard you correctly, you had mentioned when talking about ingesting discernible or perceptible vapors, it is not enough to just feel them in your throat. You have to be sure that they've gone down. Now, once you feel them in your throat, how can you tell from that point afterwards whether they've actually gone down or not? So why would not just feeling them in your throat be sufficient to determine that your fast has broken? That's my first question. And my other question, which I guess kind of is, part of the larger question, is if you insert a suppository in your rectum, supposing you don't insert it all the way up to the place of hukna, it's just about an inch in, do you assume that it's traveled up till that point and gone up towards the intestine, or do you have to physically put it that far? So I guess the general question is, do you go with caution? So you kind of assume that it's made its way up to a al-jawf al-mu'tabar, or do you, unless you're 100% sure, you will just assume that your fast is intact?
Okay, your first question, I think, is a bit of a misquote. I didn't say that. What I was referring to is tasting. Okay, so if you can taste, and this is very clearly outlined in the fiqh literature, just by tasting it at the back of the throat, in essence, we recognize that what that is referring to is the back of the tongue. So there's the bitter sense, sensation center is at the back of the tongue. That does not indicate that you have invalidated your fast, but rather you must feel it pass the lower end. Now, my research, my tahqiq that I've done, and this paper should be out, like I said, over the next 1 or 2 days, I will address this, is whereabouts is the halaq. Yeah, the halaq, more specifically to the fuqaha, is more am and general for the on a general common usage. So halaq here is referring to the bottom end of the oropharynx and the laryngopharynx. So this is the area that is referred to as halaq from a Sharia perspective. So in other words, you must feel, and there must be some element, because al-yaqinu la yazulu bi-shak. So yaqeen, meaning certainty, is not removed on the basis of doubt. So you must have some element of what we call, going back to that point of ghalabat al-dhann, predominant probability or understanding that, look, I can actually feel this going down to the bottom end of my throat, and that would be the indication that you have actually invalidated your fast. Prior to that, it wouldn't. Even if you were to feel the taste, so people have mentioned that I use eye drops, and sometimes I can feel the taste at the back of the throat. What that's doing is it's just at the back of the tongue that you've felt, you've sort of sensed the bitterness. It's not actually gone down your throat exactly. I mean, these things are very particular and very specific, but they're very important, and they're causing a lot of complexity and confusion. Hence, I spent quite a bit of time putting this document together. So inshallah, it should address a lot of those issues. The second question related to suppository, you have to understand that suppository, the whole purpose of a suppository is that it goes in deep enough for it to actually be absorbed. Otherwise, it doesn't really essence carry out the duty it's supposed to be doing. So if you're going to use a suppository, then that will invalidate regardless, because that's the purpose of the suppository. It goes in deep enough that it is absorbed.
Okay, I hope that answers your question. I still see quite a number of raised hands. I just go to one written question. This is for Dr. Nazim Ghouri. Has BIMA considered getting acknowledgements of their guidelines from Islamic scholars and Muftis representing the British community to help more compliance of the patients with these criteria? As we know, the final decision to fast or not to fast rests with the patients, and we know that generally they bond more with the scholars of their school in these matters.
So I think I need to highlight that we have if you go to the BBSI website, the BIMA guidance is put on it, and we know a number of scholars and imams that are on the BBSI website. So I spoke to Dr. Sheikh 𝐁𝐚𝐥𝐚𝐿 about it, and they're all good with what's in our guidance. So in essence, if there are scholars and imams who are affiliated or who are with the people on the BBSI board, then it's covered up. I accept there will be matters of ikhtilaf, and there'll be something which will be subtly different, and we've acknowledged that in the guidance. But largely this guidance is very clinical. There is some stuff on fiqh. It's all been referenced in terms of the primary sources as much as we can. If not, it's been referenced to a couple of the papers that have been written, which go back to the primary text. So there's a sanad, there's a chain there in relation to that. So it's a case now of recognizing that we have the formal support of BBSI as one body, and using that as much as we can. But equally, it's for the individuals, perhaps the contributors themselves, to go to their mosques or to their organization. Look, we have this guidance here. Please share and use it. One thing we're very clear with it, it's not authoritative or prescriptive, it's recommendations. So it's more a document for clinicians, but I accept that, yes, making it familiar with their various ulama, whether it's in the mosque capacity or in education institutional capacity, should be done. But remember, this guidance just literally came out at the start of Ramadan. We need to understand the time frame we're working with and where we've got to, and who it's aimed at. So I think what we need to do is perhaps maybe from the aspect of BIMA is highlight that we have one body on board which has formally supported, contributed to whatever it may be. The same way we have contributed to some of their guidance to do end of life matters, which they have published on their website. The other thing as well, there was a mention about involvement of more scholars. Did mention only the name of Dr. Sheikh 𝐁𝐴𝐿 is on the list of contributors, but again, he's representing a whole other people. I don't want to go into a list of 50 other names on a list. And the second thing is we have published a lot of stuff which you have referenced, and there's other scholars which have given the fatwa, for example, on PPU, which you have referenced too. So it's all there implicitly. It's just a case of people going to the guidance and understanding and seeing the connections that are there. We can't put every single person's name there. But what I would say is that if you look at the references and how it's that are there, and who's been involved with the other pieces of work, there is significant scholarly input in that regard.
Dr. Arshad, can I just elaborate on a point there? I think what we need to recognize here is, number one, there are certain principles from the Sharia perspective that we're using to provide guidance to this document. And then the rest is within the remit of medicine. And those principles, I don't think there's any difference of opinion about them. They're very clear principles that you'll find in all the different schools of thought, from the Sunni perspective anyway. So, you know, and they're sort of things that people don't dispute on amongst the sort of the knowledge, those ulama, they don't dispute on them. So if this is solely in terms of its application and its acceptance, you know, more generally, and having ulama, different ulama's names on there just to clarify that point, then that's a separate discussion. But in terms of the validity of what's been done, I don't think there's any question of that. It's just a question of its acceptance amongst different groups of people, Muslims around the world or around UK, whatever.
There, I've now opened the mic for Shariful Islam. You can unmute yourself and ask the question. Shaykh al-Islam, do you want to ask the question? You just have to unmute yourself and you can ask your question now.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
So I'm sorry that I am again going back towards the topic on suppository. So if a case where a patient has got constipation and I need to do a single dose of glycerin suppository. So it is not like that it is absorbed in the upper part of the intestine. So if I use suppository for constipation, like glycerin suppository, or any other local constituents suppository like apricot, like that, will it invalidate the fasting? And my second question is that, so I need to be is a little more clear about the point that the mixing the saliva of a husband and wife, would it invalidate the fasting? Thank you so much. Jazakumullah khairan.
Jazakallah khair.
Okay, so this is a discussion of the rectal end. So on that basis, in essence, I suppose the important thing to note here is what is the jawf al-mu'tabar? What is the qualified cavity? The qualified cavity, like I mentioned more specifically, extends from the lower end of the throat, so i.e. the lower end of the oropharynx, laryngopharynx, and extends all the way to the rectal end, where there is a membrane that absorbs, and clearly you can apply medicine in that area. So as long as it falls within that sort of area, that is considered as jawf al-mu'tabar, and this is what is outlined by the fuqaha. So this is there. So that, hopefully that addresses the question. So if you're using any kind of medication rectally and it's clearly being absorbed through the membrane or the lining of the sort of the lower end of the sort of rectal area, then that would invalidate the fast. The second point was regarding the saliva. Now, again, it goes back to the same point again, which I mentioned earlier on. As long as you know for sure that it's going down your throat, the lower end of your throat, then it would invalidate. So the Prophet ﷺ, in that instance, he did a qiyas, he did an analogy of gargling. So when you gargle, okay, then when by gargling you don't actually, the idea you try to avoid actually swallowing the water. So on that basis, then your fast will not invalidate, and the same ruling would apply here. So recognizing that there is something which is accepted in Islam, and that is if a very small amount, negligible amount, passes your throat when you're using miswak or when you're gargling, clearly that we know that there's a very good chance that will happen. That is unavoidable. For that reason, that's excused. But generally speaking, overall, if you felt that it clearly is going down your throat and it's done with that intention as well, then that would be invalidating.
Okay, so we've got about 5 minutes to go. I'll try and take some last few questions. So this one is probably for Dr. Nazim Ghouri. What measures have been taken to audit the usage of the rapid review guidelines and also the understanding amongst the various stakeholders that require them? I only ask this as I'm aware that healthcare professional scholars alike find using the guidance difficult. I
mean, there's an email address there where people can email back with queries, and people have done that and they've edited as appropriate. I think the other thing is I've listed about 5 or 6 different bodies, national bodies, specialist bodies, who have formally signposted towards the guidance or have endorsed it, which would indicate that it's at a standard which they would expect that can be used. They wouldn't reference something as in terms of formal. I mean, the BTS are an established authoritative body when it comes to respiratory disease in the UK. They would not endorse it if they felt, for example, it wasn't usable or wasn't clinically relevant or accurate. So by the discussions that I've had with the Royal College of Physicians London in terms of my email correspondence, we're waiting for, the British Cardiac Society had some questions about the drug conversion table, but again, we're just clarifying things with them. I know, for example, the specialty lead for diabetes endocrinology for the college has given his formal endorsement saying it should be endorsed as is. And for example, the Renal Association makes reference to the renal sections and transplant and haven't questioned. So we're getting the feedback in terms of the kind of validity or the level of guidance there. In terms of the usability, as with any form of guidance, it's only there as a guide, and we won't be able to please everybody the way it is, but we hope by using a standardized system, using the traffic light system from the Diabetes and Ramadan Alliance, which diabetes specialists have been using for years, and GPs as a result of following that guidance, that it's something there that they should be familiar with. We don't want to come up with something new and then go through, get it recognized by X, Y, and Z bodies or whatever. We wanted to use something that's already there and apply it to new specialties. Remember, it's not been done before. I expect over time it will review and refine and inshallah become something that is more usable. So the email address is there, and we encourage people to certainly use it. In terms of its reach, I know that people have been using it from different parts of the world and also different parts of the UK based on the anecdotal data that's coming through. I'm sure BIMA can maybe track the number of times that the document's being downloaded or visited, but equally a lot of these societies themselves have posted the guidance on their own website, so they don't need to come to BIMA to do it. They just update as we update. So but certainly I think the email address has been quite good, because we have got to version 1.3. A lot of it's because of changes that we ourselves have felt are required, but there have been a couple of emails that have come through, and certainly the feedback from the college from the various areas we've been taking on board.
Okay, I'll have a quick fire round with Dr. Sheikh Rafaqat Rashid. Pretty much yes and no answers, really. Can you donate blood while fasting?
It's not encouraged because it makes you feel weak. So anything that makes you feel weak, so if there's any da'if, in the body, any weakness, or that inevitable, there's a consequences as a result that you may have to end up breaking your fast, then that is disliked. So my recommendation is not to during Ramadan, but to do it after. But if you did do it, it wouldn't break your fast.
Can showering be compared to a vaporizer? Because the water vapor, which is inhaled, there is a possibility, or you can feel that inhaling. So a warm bath, basically.
If you have a shower, it's not really an issue, even if it's a warm bath. The main point is that if you are intentionally inhaling the steam in there, and with the intention that to go past your throat, then that would, and it does, then that would invalidate. Someone using humidifiers, yeah. Sure.
So if someone incorrectly assumed that they had invalidated their fast, so in fact it was a valid fast, and they thought that doing certain procedure or having certain thing administered has broken their fast, when it hasn't, and they ended up eating and drinking for the rest of the day, do they have to make up for it by fasting for 1 day, or do they have to fast for 60 days?
So Jahl fi tahrim, this is related to the idea that you're ignorant of the ruling. That's not a concession in itself. So in other words, that gives us a real purpose that we should go out and find out the rulings for everything. But if you were to find that, I remember there's issues of controversy as well. So recognize there's issues of controversy. So on that basis, that if you were to do a particular act, which later on you discover clearly that everybody agrees that it's invalidating, then on that basis you would have to, if you've started eating after that, you'd have to make up for the fast, regardless of that anyway, because you've invalidated it anyway. But even if you were not sure, but then on that basis you acted upon that and you decided it's invalidated fast, you started eating, then that would actually then invalidate your fast again.
I'll just take one last question. This is a live question. So Muhammad Chinwari, you're unmuted now. So if you unmute yourself, you should be able to ask the question.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Can you just tell us what the question is?
Thank you very much. My question is to Dr. Sheikh Rafaqat. Dr. Rafaqat, thank you very much for updating your presentation. It's the third time I've heard your presentation, and I was expecting that probably we'll have some more up to date, and I'm looking forward to see your paper when you mention about halaq. I'm confused with listening to various ulama and fuqaha about fasting, invalidating of the fasting with the eye drops and ear drops and nose drops and anal root. It's an academic question. I don't understand this jawful mu'tabar. I'm a GI surgeon, so GI tract for me starts from mouth till anal canal. So any disease which is there, or any absorption or any penetration, the GI tract starts from mouth to anal canal. What is exactly jawful mu'tabar? So far we learned from the fuqaha, from the historian, anatomy where they didn't have the real concept of anatomy now, which what we have got. So anal canal is a part of anal GI tract. Rectum, suppositories goes in the rectum, comes out with the glycerin one. GT cream applies to the anal canal fissure. Does it validate or not? Same thing applies for the mouth. With a mouth ulcer, you got a local anesthetic or cream, or you got GT and sublingual type of cream. That again, it doesn't go to Jawful Mu'tabar, but does it break the fast or doesn't break the fast? And the definition of a halaq, I don't know how would you define halaq from Islamic knowledge perspective, or would you define it from the medical knowledge perspective? I hope this question is clear.
Okay, so we can only go by number one, how the fuqaha basically deduce rulings from the Quran and Sunnah. So they use tools whereby they then deduce rulings directly from the Quran and the prophetic tradition. The different schools have slightly different approaches, so they do it on the basis of accepting certain hadith and not accepting others, or accepting certain hadith within certain paradigms. And also in terms of wordings of the Quran, how they relate to that. So you have amongst the general mass of classical scholars, you have differences of opinion. Now, depending on your sort of school of thought that you are following, you'll find that they have their own approach and they will therefore come to their conclusion. Now, I'm making reference to a kitab called Bada'i Sanai of Imam Kasani, and in there he elaborates on a couple of things, and these are also been elaborated by Ibn Rushd and many other scholars. And they talk about the fact that the reality here is more in line with the idea that there is what we call suratan wa ma'nan when it comes to eating and drinking, right? When it comes to suratan, that means is the act itself of eating and drinking. Okay, so that identifies mainly that something passes the halq. Okay, now putting something in your mouth is not considered as swallowing. So you have to go through the process of ibtila, which basically means that you have to swallow something. The question now arises, at what point would you say that this is now swallowing? So the fuqaha elaborate on that point, and they say that the point whereby you know for sure that once it has passed that level in the throat, that it is now going to enter the gullet and going to the stomach, then that would be considered as the halaq. Shari halaq, not just the arm. So be aware that you're not using it from the general. So the medical understanding of how we decide different, classify different parts of our anatomy doesn't have to, Islam doesn't have to align itself according to that. It has its own definitions and descriptions of how things become the way they are. So from that perspective, I don't say it's the laryngopharynx, I say it's basically the bottom end of the oropharynx, because this is the batin of the halaq. That is what is referred to by the scholars. So there's a lot more detail. It'll be in the paper. I'm not going to elaborate it on here. But generally speaking, same thing with the rectal area. The rectal area is not elaborated upon. So you talk about the hukm area that some people keep making reference to. But the main point here is that if medicine is applied to the rectal area, and there clearly that is introduced and it goes into and absorbs, and that is clearly, well, that's the essence of it. It's different from the mouth. The thumb is different from because the point there is once it disappears from view, that's one thing. And the other thing is that the fact that it actually is absorbed in that particular area, then that area would be considered as a jawful mu'tabar. So the halaq area, lower end of the throat, all the way down to the rectal area where and suppositories, the intention there is. So remember, your niyyah is very important here. Your intention is that you want it to be absorbed in there. Okay, so that's the whole point. Yeah, you're not putting it in there just for any other reason. You're doing it with that particular perspective and intention in mind. So just on the basis of your intention, if it does enter, then that would suffice. But the paper should elaborate, so we won't go into too much detail, inshallah.
Jazakallah khairan. I think I would like to now conclude. We are already 6 minutes over our time. Just like to give a final chance to any of our panelists to share any final comments. So Dr. Billal Patel, anything to say?
No, it's just thank you very much for inviting me, and it's really good to see Sheikh Rafaqat after all these years.
MashaAllah.
Jazakallah khair. Yeah, you told me you were uni fellows, mashallah. So, and Dr. Nazim Ghouri.
Once again, Jazakallah khair. Thank you for allowing me to talk a bit about the BIMA guidance and help give it a context in terms of its usage. Also grateful to be able to share a platform with Dr. Billal and Sheikh Rafaqat. I think one thing I would say that a lot of these questions that arise in terms of does this invalidate the fast or does that invalidate the fast, one has to take a step back and say, should you really be fasting in the first place with that ailment or condition? If there are certain therapies or treatments involved, will it or won't invalidate? Maybe that fast should actually be broken. You shouldn't be in a state of fasting if you're requiring certain treatments. You need to use common sense and take a step back. If you're that ill or you're in hospital, why are you fasting in the first place? Clearly you might have had a fever, you had infection. So we need to sometimes move away from the theoretical questions and understand a pragmatic approach to things.
Okay, Dr. Sheikh Rafaqat?
Yeah, I think because we've emphasized the point of fiqh, of medicine here, again, as I did in my presentation, I think it's very important to understand the fiqh. Fiqh is not just about legal rulings, it expands beyond that. And especially Sharia, it encompasses theology, many other things. So I think that the main message to take from this is these are discussions and they will always happen and there'll always be slight differences of opinion related to it. There will be a difference of opinion on what will be the most important thing for us is our ikhlas, our intention, our sincerity, and our turning to Allah subhanahu wa ta'ala. So the important is that we should turn to Allah and ensure that what we are doing, what we are performing, that it at least imbibes an element of taqwa in our hearts. And if we can do that, then alhamdulillah, we have been successful in Ramadan.
Jazakallahu khairan, everybody, our panelists, and especially to all the attendees who've attended today for this live webinar. The recording will be shared on Balagh YouTube channel later as well, inshallah. Just a final request to support Balagh Academy with your du'as, first of all, in the month of Ramadan, and also support by attending the webinars, as most of them have been free recently, but also the paid ones as well, and support this work, which is not just limited to UK, but is being translated across the world. May Allah Ta'ala accept it from all of us. With that, I'd like to conclude today's webinar. Subhanallah wa bihamdih, subhanakallah wa bihamdik, nashhadu an la ilaha illa anta, astaghfiruka wa natubu ilayh. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.